It all started in 1969 when two nurses were diagnosed with a strange illness. No one knew what it was, but it didn't take long before they found out that the disease was transmitted by a species of multi-mammate rat, the Mastomys natalensis, in a community called Lassa in Borno State, northeastern Nigeria. And there came the name Lassa fever. The disease, which affects several organs such as the liver, spleen and the kidneys, is endemic in Nigeria, Sierra Leone, Liberia and Guinea, and also in Benin Republic, Togo, Ghana, Cote d'Ivoire, Burkina Faso and Mali. Ike Nahotu is a survivor of Lassa fever. He lives in Abakaliki in Ebonyi State, which is among the top 3 states where the disease is endemic. He shared his experience with me.
I was down with fever, and I thought maybe something that I could maybe after resting. I rested, slept all the day, and woke up in the evening, and the fever was much, so I had to take an anti-malaria drug. I took the anti-malaria drug for 3 days. Still nothing happened. I was not fine. So I thought maybe typhoid. I called the medical doctor who recommended a typhoid drug that I took for about 2 days. Still nothing happened. So a doctor, who is my neighbor, just had to come and give me some medication. The second day he said it was malaria typhoid. So they started treatment. So I was in the hospital, the private hospital, for about 3 days. Even at that, nothing positive happened. I was still down, as at that time I was vomiting, I was stooling, weakness, so I just had to tell them to discharge me.
A WHO disease outbreak report for 2020 shows that about 26 states in Nigeria recorded 472 confirmed cases of Lassa fever, with 70 deaths within the first quarter of the year. The top 5 being Edo State with 167 confirmed cases, Ondo State with 156, Ebonyi with 30, Taraba State 25 and Bauchi State with 14 cases. Dr. Ephraim Ogbaini Emovon is the head of the Institute of Lassa Fever Research and Control at the Irua Specialist Teaching Hospital in Edo State. He spoke with me on some of the challenges in eradicating Lassa fever more than 51 years after it was detected.
The treatment for Lassa fever has not been very specific to just the experience we are having with COVID. We have just one drug now that is being used, ribavirin, and this drug is still yet to undergo a clear clinical trial. Just the argument to have about chloroquine, azithromycin, and other therapeutics for COVID. Lassa fever, the drug that is being used, ribavirin, is an off-label drug. It was also designed for other treatment of hepatitis.
Look for places to stay.
And Professor Rosemary Audu, a virologist and the director of research at the Nigeria Institute of Medical Research in Lagos, said more effort is needed in surveillance and funding of research.
We know that we have the challenge with funding of research in Nigeria, and so it's only what we give to it that we can get from it. So since not much is put into it, not much is gotten out of it. However, many people will want to stay at home and treat themselves, and so they don't present early. And if they don't present early, the drugs also will not be effective, because studies have shown that the drugs are not effective after the first week.
They both told me it will take deliberate enlightenment and change of habit to wipe out Lassa fever for good.
We need to increase sensitization to ensure that people who are presenting with fever, having treated for malaria and typhoid, they are not responding. They should test for Lassa fever early enough, because a lot of people that die of Lassa will die because they came in at the time they are already bleeding, they have kidney failure, And they did it present early. So the earlier we start doing testing and managing the patients, the better. Then we need to increase the training of our healthcare workers.
We really have to maintain good hygiene. We have to keep our environment clean and protect them from rodents. Okay, we should use maybe nets, to block the doors and windows to prevent these rodents from coming in. And then for our food also, we should protect them, keep them in containers that are sealed so that rats don't get into them. And then we should dispose of our waste far away from the homes.
In the last few years, international organizations like Alliance for International Medical Action, in partnership with other agencies working with the NCDC, state governments and WHO, are helping in the conduct of research on further treatment of Lassa fever in parts of the country. Almuneda Marisaiz is a medical anthropologist who has worked on some tropical diseases like Ebola and Lassa fever in West Africa. Her team embarked on a project to depopulate rodents in 3 villages in Upper Guinea, which had prevalence of Lassa fever. First, they carried out enlightenment in the community on the dangers of living with rodents. The villagers bought into it, and together they launched a 4-year campaign to wipe out rodents from the villages using anticoagulant rodenticides. The chemicals were distributed to households, which they all applied at home while maintaining clean environment within their surroundings. In the 4-year period, rodent population dropped from 16% to 1%, which drastically cut down the prevalence of Lassa fever in Upper Guinea.
We need to control rodents effectively to control Lassa fever. Now, controlling rodents at homes means you need to eradicate rodents. It's either by deratting your house with any means so that rodents are not in your living spaces, in your kitchens. You ensure food protection. You cover your food, make sure they are in resistant containers that the rodent cannot even penetrate.
The virologists I spoke with all agreed that depopulating rats and rodents from our communities might be the most effective way of reducing the prevalence of Lassa fever in our country, while we await the outcome of research on vaccines. With this, the community and local government can partner on this, as it was done in Upper Guinea. This might just be the way to lock out Lassa fever for good in our country.